Hi, I'm your host, Marsha Florence for Just Ask Talk Show. Today's show, ladies and gentlemen, is Understanding the Medicare Maze. Hurry back and join us. I'm your host, Marsha Florence for Just Ask Talk Show. Today's show, ladies and gentlemen, is Understanding the Medicare Maze. Now, today I want to express to you all that we have a special guest in the house, well, two special guests in the house, to talk about the understanding or clarification on Medicare. It is a lot to absorb when you're trying to make that decision on which way should you go, what kind of policies do you want to have, who's going to be my carrier this year. But there's also some information that you are lacking in, so we asked the president himself, John Becker, and Rodney Ross, senior health advocate, to join us today here at the Just Ask Talk Show to give you some insight on some information that you know little about, ladies and gentlemen, and that's coverage that you may didn't think was important, but it is. So good afternoon, gentlemen.
It's good to be here, Marsha, and being president of the American Medicare Disability Advocates, it's great to help people like you've done in your career that have disability issues, because many times they get overlooked on Medicare, and that's why we founded the organization, to be there for them, to make sure they get all the benefits they deserve, because it's so sad that people don't talk to people with disabilities about Medicare. That's what we found out in surveys.
Okay. Well, you know what? Now, I disregarded saying you guys' business name, so it's the American Medicare Disability Advocates.
Right.
Correct? Okay. And overall, you guys actually help not just persons with the general information about Medicare, but you also do a special division. Is it considered a special division?
Yeah, it's really a special nonprofit that my company, Advocate Financial, set up because we saw a need to work with these folks. Because, I just recently talked to a couple of individuals that have been on Medicare for years, and they're in wheelchairs all their life. And no one ever told them about Medicare Advantage plans. So they lost out on $15,000 of benefits with dental care, food benefits, utility benefits, no-cost gym membership, and also personal emergency devices. All those things at zero cost, but no one ever communicated. And that's why we started this organization. Our goal is to communicate nationwide with those folks that are deaf. They have vision issues, they have issues of mobility, and also quite a few folks in the Down syndrome have Medicare and Medicaid and don't realize that they can have these extra benefits.
So and nobody ever told them.
Yep, and that's those darn communication hurdles. And also comfort issues too. That's another problem. So that's why we've been having workshops across the country, which I'm looking forward to discuss.
Okay. So now, Rodney, you play a big role in this, Rodney Ross. So tell us about being a senior health advocate.
So part of the AMDA, one of the most significant things that we do is we work with people who are Medicare brokers, and we train them on how to interact with, how to communicate with, and how to provide services to those persons that have disabilities. Medicare brokers, their primary business, they sit down in front of people and they try to get people to enroll in a plan. They go meet with them, talk for an hour, sign them up, then they go disappear. However, being trained in working with persons with disabilities, we learn the importance of listening, the importance of not just trying to sit down and have a conversation with someone just to get the customer and to sign somebody up. we actually are turning the whole process on its side in terms of teaching advocates and like myself that you may have to have 2 or 3 meetings with people. You need to understand, does someone need to have a person there with them to assist in you talking with them and explaining and clarifying the information? So we provide through AMDA training certification, and that is how the Medicare brokers that are committed, that's how they learn the tools and the skills for serving persons that have visual disabilities, hearing disabilities, mobility disabilities.
That's great. That's great. And, you know, and I'm glad you guys came to see us today, because actually we do know that, you know, there's a certain time of the year there's open enrollment, okay, and people are climbing all over each other. So what is that period?
Well, annually, the Medicare program has October 1st through December 7th, where every American can change their plans with no problems. It's guaranteed issue. And they can focus on their needs. And we talk about disability folks because we know their needs aren't being met. But how about the average senior? The average senior needs a Medicare advocate like Rodney to help them understand what's out there. Maybe you need more help on your hearing aids. Maybe you need vision and glasses. Maybe you might need a lot of dental work. Each Medicare plan has a special niche. So one of our roles is to make sure every American who's on Medicare gets the right program. And we're about building relationships and being there for them. Because one of the problems we've seen in this industry is a lot of folks, which are Medicare agents, they help you and then they disappear. We help you and we are a relationship and we are there for you. That's what makes us different.
Great, great. So actually you guys' mission, you know, is unique in itself.
So Marsha, the other part, just to piggyback on what John said, the other part is many Medicare agents, they're not willing to commit the time and the effort to providing the extra service. My first personal experience was working with a family that had autism involved, and there were 2 twins that had autism, and the family was on Medicare and Medicaid. They could not find dental services because a person that has autism is not necessarily going to sit in a dentist chair, open their mouth, and allow the dentist to probe them and do what they do without the need for sedation. Sedation is not something that just routinely happens when you're talking about dental work. And there are many dentists that are not comfortable with just doing sedation. Also, benefits, medical benefits don't just necessarily cover that procedure. So I had a very difficult time, very challenging time working through the system, trying to find providers, trying to get insurance plans that also understood and that would work with the family. One other issue that the family had was this. The family I mentioned was on Medicaid. Well, the state of Michigan, they actually were threatening the family that they were going to discontinue benefits for the family because the persons on Medicaid, they had autism. They were not getting routine visits,
physicals or anything.
and Medicaid kept coming back to the family saying, "No, you're not caring for them correctly." But they did not point the family to resources.
And that's one of the reasons I think it's so important to have you guys join us today to, like you said, understand, you know, the Medicare Maze. A lot of people just don't get it. So I tell you what, we're going to take a break and we'll be right back with some more good information. We'll be right back.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
And and welcome back to the show. Now, ladies and gentlemen, if you're just now tuning in, you know what I always say. Get your pen and paper out. Know you got questions. So if you have questions, look at the number at the bottom of the screen, 1-800-323-5336. You can always send me a question or even email me, Marcia at Just Ask Talk Show, and I will get your questions over to these gentlemen in case you have some concerns about something you're not sure about in dealing with your Medicare or Medicaid coverage. So today's show is understanding the Medicare Maze, but these gentlemen are breaking down the myths that you all feel like, okay, I can only do this in a certain time of the year. Well, today we get to find out what you can do all year long, what you missed out on, and what is in the future for you. So now, Rodney, I wanted to ask you, recently, there's a lot of talk about redetermination. I mean, what is redetermination?
Yeah. So, Marcia, redetermination, that pertains specifically to Medicaid benefits. Medicaid benefits are those benefits that persons that meet income level requirements for the government, low income, they qualify for governmental services through Medicaid, the state plan. Now, the government always requires that a person prove their eligibility to receive the benefits and to continue receiving the benefits. Redetermination is really the process of demonstrating on an annual basis that you continue to meet the income requirements. When the pandemic came, that was when the process of having to prove it every year stopped. So from 2020, to 2023, there was no redetermination requirement. But the government has reinstituted the requirement to prove yourself still eligible, and they're calling it redetermination. That process started April 1st of this year, and here's the impact. There are people that have not had to prove their income eligibility for the last 3 years that are now potentially going to lose their Medicaid benefits because they either are getting forms and they're not returning them, or they're getting forms and they're filling them out, return them, and they're no longer meeting the income requirements. So those persons are at risk for being cut off from their Medicaid health benefits.
Now, let me say this, because by the time this show airs and everything, there's going to be a ball of confusion. I mean, we know that, with open enrollment period, that people are going to be climbing on the walls trying to figure out, did I get the right one? How do they know when they should apply for or what they should apply for? If redetermination has been reinstated and now you have to prove your income level or your eligibility, whatever it may be, it's going to confuse people, because those who have young children with disabilities who have Medicare, Medicaid, they're concerned about, am I going to be taken care of, my kid's going to be taken care of, or even a senior person who's unable to complete these processes. Is that where you guys come in?
Absolutely. And no, this is where being an advocate, such as what we are, is so much different than those persons who are insurance agents, Medicare agents, who simply enroll people, sign people up, then they disappear. Advocates, our role, we stick with our families, we stick with our clients, and we guide them through this process. So our clients, they get communications from us, and we are actually talking to them about, watch out for the letter that you're going to get from the Michigan Department of Health and Human Services. If you get a letter from them and you're not sure what it is, call us. Mm-hmm. We actually go and meet with our clients and we review their mail with them. We help to answer those questions by way of reading it, interpreting it, and then helping to fill applications out.
Okay.
So as advocates, that's the role that we play, which is completely different, or at least significantly different than that of what a regular agent does.
Well, I think, in general, the public is confused between the advocate and the agent. I mean, if I say I'm signing up with my usual insurance company, I'm believing that the agent is representing me. So when I call and I ask a question, they can tell me what I'm eligible for. However, if I have, say, Blue Cross Blue Shield Advantage Care, and it's got Medicare connected to it, I'm looking at it like, well, I've met Medicare. If I got Medicare connected to my general insurance, I'm thinking they're telling me everything that I have, that I'm eligible for, but they're not, because I don't know what to ask for and I don't know what to ask about.
What you said, that's valid. Mm-hmm. Here's the real backdrop to that. There are so many seniors, unfortunately, who signed up for health care on an 800 number phone call.
Correct.
And they don't have a face-to-face relationship with the person, such as the advocate, that goes to them, sits in front of them, explains the information by way of sharing, here's what the company's book looks like. Here's the information from the company's book, not just from my mouth. And that's how we service them. And after the fact, they also rely upon us when they have a question or an issue. Our clients, when they have a question, here's what they're told not to do. Do not get your ID card out, turn it over, and look at that small number on the back for customer service and call that. Don't do that. Go to your refrigerator where our magnet, our phone number is, and you call us. And that is how we service our clients.
That's where the confusion is. So let me ask you, and John, if you could, what is the big difference between Medicare and Medicaid?
Well, Medicaid is for folks that have low income and limited resource and sometimes health issues. You see many children on Medicaid. It's a state program that really serves the basic needs of folks that have limited income and resources, assets. You can't have a lot of money in the bank. Usually you can't have more than $2,000 when you're on Medicaid. When you look at Medicare and Medicaid, it's really for people who have Medicare, also with limited resources, and the state awards you, because of limited resources, Medicaid and Medicare, which means you do not pay any Part B premium. Because when you're on Medicare, Part A, which is a hospitalization, is no cost because you paid into the Medicare tax all your life. Part B is for the doctor and diagnostic testing and things of that nature. You have to pay a Part B premium, which is, I think, $164 a month. But if you're on Medicaid or you're on the Medicare Savings Program, which an advocate like Rodney will help you get, you don't have to pay that. But you still get all of those basic needs. Now, what we recommend a lot of folks, because all the extra benefits we talked about, food benefits, hearing, over-the-counter, transportation, and respite care, those benefits come from what we call Part C, Medicare Advantage plans. Right. And the great news about that is every American that turns 65, they give you a 7-month period where you can sign up at no cost a Medicare Advantage plan, and you get prescription drugs, and many of them are no cost. You get all these other benefits that we just talked about, especially the dental. That's a big one.
Oh, yeah.
It's a huge one. And many people don't realize they have that. And the other thing that's really dazzling, if you do good health activities, preventative care, some of the carriers will give you $200 to $300 in gift cards to your favorite department store.
I noticed that lately. I'm like, okay, why am I getting this? Okay.
Yeah, so we have a lot of those things. And so the difference between Medicare and Medicaid is everyone 65 and older who's been disabled 2 years or longer can get Medicare. People with limited financial resources can get Medicaid. And if you're Medicare available, you can have both Medicare and Medicaid, and you get a better Medicare Advantage that pays more benefits to you.
Okay.
So it's really, you need somebody to sit down and go over that with you, and that's what we do with the AMDA, and also that's what we do with advocates like Rodney.
Well, I'm hoping that, like I said, today people got a very, very clear understanding of what the difference is and, how they should go about trying to get through this redetermination period, because this is, it's kind of like a headache to know that, we're going to go through this every year, and then all of a sudden it dies down after December, and we're back to normal. But somebody missed the opportunity to fill out the application because they didn't know what to apply for under the fear that they don't know what's what. So let's take a break, and ladies and gentlemen, we'll be right back with some more good information. I know you're listening.
If you love them enough to drive an hour to cheer them on as they get beat 11-0 in the rain, then surely you'll check NHTSA.gov/the right seat to make sure they're correctly buckled in the back seat.
And welcome back to the show. Now, ladies and gentlemen, you know, we can't just have one segment with these two gentlemen. We have to ask them to come back again because actually I know a lot of our viewers are having a lot of confusion about when to apply, how to apply, and what benefits are out there for them to apply to. So, but I wanted to share this book. I held this book in my lap all this time, okay? So I wanted you to see this book because when I met these two gentlemen, it was a workshop, a training workshop to help their advocates become better advocates in serving our population. So if you see it, it says American Medicare Disability Advocates. Okay, it was a very good workshop, and you guys do this from state to state?
Yes, it's a national program.
Okay.
We're doing it in Arizona. We're going to do it in Chicago. We did one recently in Cleveland and Indianapolis.
Okay.
And we had one in the beautiful Detroit area.
That's right, and that's where I got my book from. So you may not have a book like this, but you can have the resources in the book like this, okay? So I definitely want you to, at the bottom of the screen, see the phone numbers for Rodney Ross and the president himself, John Becker, and at the end of the credit roll, you'll see the information as well. So we do have some more questions for you guys, and ladies and gentlemen, if you see this brochure anywhere around now, this is these guys right here. You need to call the number, okay, and ask them because you don't have to just be a senior seeking services, and that's another thing too. We want to make sure that people are aware that our disabled population are aware of some of the resources. That's where we fall short at. People with disabilities feel like that they're at a standstill. They can't get a new chair. They can't get a walker. They can't get dental. So, John, I want you to elaborate on some of that information. That what is it that the people with disabilities can look forward to when they actually have this type of program?
Well, one of the things, some of the plans have safety devices that do fall prevention. Some of them, almost all of them, have emergency devices. So when you fall and you can't get up, you push a button and someone comes to help you. The other thing is because of inflation and other those issues, they're all coming up with food cards. I couldn't believe it. Utility benefits, even helping you pay rent out of your Medicare Advantage plan. I was really happy when I saw that you can buy glasses, pay 100% of the expenses on many plans, and even have all your hearing aids paid for. And how about transportation? Many pastors and churches know that they need to help their parishioners in their congregation how to get to the doctor. How about having a Medicare Advantage plan to give you no-cost transportation? And how about gym membership at no cost? So there's all of these benefits that we can bring to you, and we can bring it to people with disabilities because they're overlooked. One of the reasons why we started the group is we're not going to overlook anyone with disabilities. That's our goal. That's what we're striving to do. And especially working with the people who have hearing loss and the deaf community. Can we even find a deaf Medicare navigator? That's one of the things that the AMDA is working on. Engaging the community to help the community. So we are going to create opportunities for people who have disabilities to be Medicare navigators because they understand the needs, and when they understand the needs, solutions happen and better health care happens, and they save money too. So we're really excited about that. And one of the reasons why we have the Society of Certified Senior Advisors degree, Rodney and I, it's a national exam that we have to take to have the professional designation, is we want to do more for people that we work with. If you have a great advisor on Medicare that's working with you, available to you, keep them. But a lot of people are buying over the phone Medicare Advantage plans, or they're going to the website. They don't have that relationship. They don't have somebody that can sit across them, like Rodney, who's a CSA, who is an advocate for your needs when it comes to Medicare. And the great thing about our organization and Rodney's a leader among many advocates in the state of Michigan. We have more people that have the specialized training there for people that need us. So, if you give us a call, send us an email, dial into your show, we're there to answer questions and solve problems and make sure you get your health needs met.
Great. So you guys are really a team. It's like a whole
absolutely.
It's a team of you guys, from state to state. So Rodney, if you were busy, there would be someone that can step in your shoes, is a certified senior advocate that
Yes.
can represent as well.
Yes, for sure. And Marcia, there are two things that I tell all seniors when it comes to Medicare and their health benefits. Two things that seniors should never, I said never, should never do. Thing number one, never enroll into a Medicare plan over the telephone that someone calls an 800 number.
True.
Never, ever do that. Thing number two, never enroll in the Medicare plan over the internet. Never. Well, why not? Couple reasons. Let's say scam, one reason. Let's also say, once you've done the enrollment, who do you call? Who is there to answer your questions, to tell you throughout the year how to navigate your plan? These plans, so John just spoke on, these plans have a lot of benefits. Do you know that many beneficiaries don't understand their plan? They don't know how it works.
That is so
They don't
true.
know all the benefits.
Right.
And they don't have anyone that proactively, that's the word, proactively communicates with them to say, hey, Joe, you know, you've got this benefit where you can get some gift cards by getting immunizations, by getting a colonoscopy, by getting preventive services. Your plan will give you discount cards.
So this is why we say you're running the risk if you don't have an advocate versus
Absolutely.
okay, a Medicare advocate. Because a lot of people just
Absolutely.
look at, like you said, they're on the internet, they're on the phone, you know, and every now and then they may go to a conference and they say, well, they told me they was going to help me. So in helping them doesn't mean that they were eligible or not eligible for the benefits, but they didn't know. They didn't get the full Monty to know what they're eligible for. And most seniors are looking for dental and hearing and vision.
And see, October to December, that's when there's this mass flurry of activity. However, beneficiaries need to also be served during the rest of the year. And if you don't have an advocate, if you don't know who to call,
That's true.
if you have to rely upon calling a customer service, good luck to you. Going through 29 prompts on the phone for 5 or 6 minutes before you get to a live human being who may or may not know the answer to your question, completely different. That's not a great experience.
You know, I'm glad you clarified that. And I may cut you off, Rodney, but I'll tell you this, because I'm a hearing impaired person, I do take it serious that when it's time for me to get my information, who am I talking to? Do I get a chance to see you? What information are you going to send me so I can read it if I can? But I like that in-person relationship so I can understand clearly what it is that I can and cannot have. Well, I tell you what, you guys did a wonderful job today helping us understand the Medicare Maze. Will you come back and join us again?
We would love it.
Happily.
Okay, so what we'll call when you come back again, part 2, because it's going to be ongoing. You guys can't just come this one time and somebody's at home saying, you know, I missed that, or hey, they didn't talk about this. So we will get questions from our viewers and get back to you and ask you to come back real soon.
Awesome.
It's a pleasure.
All right, thank you. Well, ladies and
Thank
gentlemen,
you.
I hated to rush. You know how I am. I'd rather take a little more time with this subject here because you know you got questions for it. But I always know that you can go to the number at the bottom of the screen, 1-800-323-5336. Hashtag Twitter. Well, is it X or Twitter anymore? I don't know what it's called. Just Ask Talk Show. Or better yet, email me, Marcia at Just Ask Talk Show. These gentlemen, John Becker and Rodney Ross, information will be in the credit roll. So if you need to contact them, please, by all means, either call me or look for their number in the credit roll. I'm your host, Marcia Florence, for Just Ask. And what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask Just Ask. I'm your host.